Sadly, we're reporting 41 new deaths today. That's a total of 4,279. Now, speaking of deaths, I do want to update you all on the data we have regarding race disparities. While the statewide racial disparity in COVID-19 deaths is not as severe as we saw at the beginning of the pandemic, we know that there are disparities, and at the regional level, in some cases, they are more pronounced. You may recall we were the first state in the country to report the disparities in cases and deaths based on race. And at that time early on, and I can't remember exactly when it was, probably sometime in early April, even though African Americans made up just 32% of the state's population, they were accounting for close to 70% of the deaths. That is very different today. Right now it's 48.65% of the deaths are among black residents in Louisiana, and while white residents make up 49.35% of COVID deaths. And now look, obviously no one is immune, but African Americans are still overrepresented. And I think what this tells us is they are more likely to live in areas and work in occupations that predispose them to contracting the illness to begin with. And then once they do, there's a greater prevalence of comorbid health conditions that make them especially vulnerable to the disease, which leads to higher hospitalization rates and, unfortunately, to higher death rates as well. Those things being heart disease, kidney disease, hypertension, diabetes, and obesity, and so forth. So that's what we're working on. That's why we created the task force to deal with health equity in Louisiana.